Etiology: thrombosis due to arteriosclerosis, embolism from atherosclerotic plaque, inflammations, periarteritis, angiospasm, raised intraocular pressure. Symptoms: amaurosis fugax, monocular repeated transient episodes of decreased vision or blindness that may occur before complete visual loss. Sudden, painless severe visual loss. Signs: profound visual loss, direct pupillary light reflex is absent. Whitish appearance of retina, fovea centralis stands out as cherry red spot. Extremely thin retinal arteries. Blood column in veins appear segmented, cattle tracking sign. Treatment: lower the IOP by acetazolamide 500 mg IV or mannitol 20% IV, paracentesis of the anterior chamber, ocular massage to dislodge the emboli. Sublingual isosorbide dintrate, inhalation of mixture of 5% carbon dioxide and 95% oxygen to relieve angiospasm. Thank you.